these people are planning as soon as possible the hospital visits they will be finishing. Okay, so let's just go for this one.
मैम
हाँ हाँ tell
मैम
me.
हॉस्पिटल विजिट ओनली फ्राइडे को होगा या डेली होगा मैम?
Because आपके रूटीन में it is Friday, but if the decision has been taken that we will finish the practical first and then we will go for classes, then what we have to do is we have to what to say, we have to accommodate the classes later on and then practical we will finish first. ऐसा कर सकते हैं, ठीक है? Because the third wave is in the middle, so you never know the third wave starts and then our visits will again stop, right? So that is
मैम 20 September where we have to go in clinics or in university?
where you people are right now. Where you people are in Guwahati itself? All of
मैम
you?
me at Guwahati.
All of you, tell me each one of you, are you people in Guwahati right now?
No ma'am.
Not in Guwahati, right?
Yes ma'am.
Okay. So for example, if notice is being given, within how many days you can reach? The 20 सितंबर वैसे भी आप लोग को आना ही है ना? उससे पहले अगर आप लोगों को प्रैक्टिकल मतलब फॉर विजिट से इफ वी आर कॉलिंग यू, सो व्हाट शुड बी द टेन्योर, कितने दिन पहले आपको बताना? टेल मी.
Ma'am, I can't hear you properly.
I am telling other people, can you hear me?
मैम बट समझ में नहीं आया.
Okay, all right. Masura, I'll talk to you once the class finishes. दोनों class जब खत्म हो जाएगा, I'll talk to you and you pass the message to other people and you also decide among yourself what will be the possible date that you can come back. Yes, the discussion did not happen. We'll see. I mean, like we can when we can arrange the practicals or hospital visits. But I'll talk to you once like once I finish the classes. Okay.
Okay, ma'am.
Okay. All right. Anyone remember what I taught in the last class? What was being taught in the last class? In the hospital operations management, what was the thing that I taught you people?
Operation management, ma'am. Role of operation management.
Yes. Okay. Um, उसमें और क्या सीखा आप लोगों ने? Role of operation management. We were discussing about this. What is that? Key issues, like key functions and the issues, right? There only we stopped, and उसके बाद we couldn't finish. So we'll go to that only directly because operation management you understood. I think by seeing the document or by reading it, you will completely understand that what is actually operation management, and also the explanations which I have given to you. Uh, it was quite easy to understand what operation management is in the hospital as well as in the different industries. So over here, this side you can see these are the functions that are coming under operation management. Okay, this side the issues that can occur in each of the functions. Okay, whenever whenever the operational functions occurs over there, there are some issues that to be considered. Some of the objectives are there or issues to be considered. Okay, in the organization, what kind of issues are there that we discussed? I think, yeah, we discussed up to this, that are there ways to reduce cycle time, steps, and choke points for key processes. That means this is only about organization. मतलब आप कैसे चीजों को organize कर रहे हो. For example, जो in lab का example दिया था आपको, you have a process of dispatching a report. Okay, so dispatching a report has many steps. Okay, what are the things that you can do to reduce those steps and the report reaches to the department as soon as possible within short limit of time, and also there is no problem in producing the report. Okay, so we have to every time see what kind of extra things we can do in order to minimize our time, maximize our efficiency. Okay, so these are the things or objective that to be considered in the organization. Issues what might occur is, due to a lot of process steps, you are actually delaying the things that has to be done in particular time. Okay, and the patient time, what is the patient waiting time is increasing. The nurses and doctors are not getting the report in the in the time, in the exact time, so that is actually making a trouble, and the diagnosis is not happening on the time because of the processes, because the processes is not planned in such a way, and in between there are bottlenecks. That is why these kind of issues might occur in the organization. Okay, next is, can we improve speed or patient satisfaction? Okay, so patient satisfaction is one of the biggest issues in all the hospitals that we have to consider. Why? For what reason the patient satisfaction is being harmed in the hospital? For what reason? What are the reason for which the patient satisfaction is being harmed in the hospital? Can you tell me?
Patient waiting time.
हाँ, पहला तो यही आता दिमाग में, बाकी और what else? Quality of care,
Misbehave by hospital.
quality of care,
Yes, ma'am.
misbehave, or improper professionalism, right? No, professionalism, lack of professionalism of the hospital or healthcare providers. And what else? Improper
Lack
planning of the
of
hospital.
communication,
Sorry, Masrura?
lack of communication between the staff and the patient.
Yeah, lack of communication. So all these issues might trigger this patient satisfaction factor, right? So why, so we have to keep in mind that what are the things that we can do to minimize the what is that, to minimize the patient waiting time, or to increase the quality care in the patients, or to improve the communications, right? So this is the function, organization, and objective, and issues also we have completed. Okay, next comes financial. So in financial operational function, what are the things that can be considered? One is, do we understand the cost accounting behind key processes? Okay, so whatever cost accounting is done for particular services, do we understand the processes? A person, maybe a operation manager, is deciding the service cost for a particular service. Does that person actually understands that these are the things that is happening while giving this care to the patient? So I need to consider each and every steps, and then plan for a particular costing. Now, we have to plan for a cost for a particular service, right? So operation management has to has that understanding. Okay, and how can we improve our revenue cycle metrics? Now, revenue cycle means what? Anyone has any idea? रेवेन्यू साइकिल मतलब क्या है? anyone? ओके, सो आप लोगों ने फाइनेंस में पढ़ा होगा, बट दिस इज ऑन, आई मीन लाइक इन particularly for the healthcare people or for the hospital managers. So basically revenue cycle is nothing but all the administrative and clinical functions that contribute to the capture, management and collection of the patient service revenue. That means whatever activity you're doing to collect the cost from the customer or the patient. Okay, so that those activities would come under revenue cycle. Okay, there are some of the metrics that we use, to to understand it, to to the revenue cycle management in a proper way. There are some of the metrics. If you go Google, and you will be getting some of the metrics that people uses to manage the revenue cycle. PEAK is one of the metrics that people are using outside. It is very popular, so that you can see peak बोल के है, peak, ठीक है, PEAK. Next is physical layout. So you know that very well, right? If the planning is not being done, the operation failures will come in hand easily. Okay, planning is one of the most important thing that reduces the operational cost in the future. Okay, and if it is not done properly, जैसे हमने last time बोला था, that unavoidable drainage of fund happens, right? So first thing क्या है यहाँ पे, objective और issues. Are our facilities designed with the consideration of speed, capacity, traffic flow, and operational efficiency? Right? Our design consideration. We talked with the architect. We asked that, this path should be connected with the OT, because we want the patient should come come to the OT without any kind of hassle. So you make a direct path from this place to OT without keeping any kind of, disturbances in between. You plan it, you tell this particular thing to the architect. Architect would now design accordingly. Okay, so he should understand that from this particular department to that particular department, communication is very important, so I have to plan it accordingly. Okay, and you also have to mention to the architect that if you are not planning it in such a way, what are the operational failure might occur in future. That is very important. You have to mention it beforehand itself. Okay, next, are unit or floor layout designed to eliminate redundancy? Okay, like for example, uh, floor layout is there, a particular HDU का floor layout है, ठीक है? So now, if you are not keeping a proper corridor, you know that it is very much important in the ICUs or in the HDUs. People would come in what? People would come in what? They will not come in the wheelchair, right? Most of the time, how they will come? Most of the time, how in HDU patients would come in HDU and ICUs? Hello? Can you hear me? Hello?
Ma'am,
Yes?
Yes, ma'am.
Can you hear me?
yes, ma'am.
Ma'am, now I can hear.
Now audible, ma'am.
हसीना बैठ बैठ के मैसेज कर रही है कि सर्टिफिकेट सेंट मैम, प्लीज चेक योर मेल. क्लास में इंटरेस्ट नहीं है आपको? आप बाद में भी बता सकते हो ना मुझे. इन बिटवीन वॉइस चला गया था क्या?
Yes, ma'am.
Okay.
Yes, ma'am.
All right. So what I am saying is that in HDU and in ICU, how the patient used to come? In what the patient would be coming in the wheelchair or by walking also. But most of the time in HDU and ICU, how the patients are come? How patient comes?
By stretcher, ma'am.
Yes, by stretcher they would come. So for stretcher, how we have to plan the floor layout?
Ramp.
Ramp, ma'am, ramp.
And there should be ramp and
And
how
there
the
should be
corridor
lift.
should be? Width of the corridor should be bigger than the other places, right? Because over there you need to keep in mind that stretcher might come at any time, and also there has to be a way, there has to be a way for traffic as well. For example, सिर्फ और सिर्फ उस कॉरिडोर से स्ट्रेचर ही अंदर आ पा रहे हैं, साइड में कोई इंसान नहीं जा पा रहे हैं, है ना? So by keeping in mind that also there a little bit amount of traffic also would be there who would be going and coming, and also one part of the way should be planned that stretcher also comes, right? So in such a way you have to design the floor layout. Okay. Next is your capacity design and planning. So it is also more like physical layout की तरह ही है, capacity design and planning. How can we reduce the bottlenecks to improve patient throughout for each area? No, sorry, throughput for each area. Okay, means what what are the bottlenecks in the sense, in the layout only you can think that in the layout we have seen that the patient has to travel a lot to go to OPD. Oh, no, to pharmacy department. From OPD the pharmacy department is very far. The pharmacy department should be just near to the OPD. Why? Because soon after purchasing, no, sorry, soon after consultation, the person would either go to the lab or otherwise they will go to the pharmacy, right? So it is very much important that in nearby OPD, the investigation area also should be located, and also the pharmacy should be located, right? So that the what is that burden doesn't increase for the patient. Definitely once after coming out of the hospital he is going to say, oh my god, what kind of hospital I entered. For one, like once after consultation I roamed around everywhere and I found the what is that pharmacy. Now if he next time what he is going to do is he is going to go for consultation for sure, but for medicines he is going to come out from the hospital and say that yes, outside only there are a lot of pharmacies, I can purchase the medicine from there itself, right? So this happens. So that is why for convenience people always look after convenience. That you have to remember in your head, that people look after convenience like anything. Even if the money goes, they doesn't, most of the time nowadays people, middle class people and the upper class people, they do not care about that how much money they are spending in the hospital or in the other areas like saloon and other places. They consider they consider about convenience, right? So we have to plan the area or the layout by seeing that how convenient it will be for us to access the patients, and how convenient it will be for the patient to access these areas. Okay, so this is the thing. Next is, in which cases should we increase the use of technology to improve labor productivity? So you also have to define, okay, capacity design and planning you're saying, right? Capacity design में फिर manpower भी आ जाता है. Okay, you are thinking that in our organization I'll be hiring less manpower, I'll be having, sorry, one second, I'm getting a call. Okay, so capacity design may we also consider manpower, as I told already. So now that you thought that in your hospital you would be making things much more technology savvy than depending upon the labors that we have, right? So we'll be making the nurses or the people whom we are hiring, we will train them we'll train them such a way that they can use the technology and actually eliminate a lot of what to say, uh, sorry, will make them efficient enough to use the technology so that the manpower is not needed much, right? So you have to make sure that in a hospital we spend a lot of money for the manpower once, but if we are spending it on the technology for once, we can get better revenue, right? Because टेक्नोलॉजी में आपको सिर्फ एक बार ही इन्वेस्टमेंट करना है, उसके बाद यू आर गेटिंग रेवेन्यूज फ्रॉम दैट only for a longer time, isn't it? But for manpower, each and every time you have to pay them, isn't it? So that is the thing. So these issues, what is that? The hospitals which are not technologically advanced, for them it is an issue. Manpower is more, and you have to pay them each and every time. For a small clerical work also you have to hire people, which can be just done by some AI thing. For example, there's just given an example for the corporate company, Accenture and Adobe, right? So these companies, they do not go through your CVs if you give your CVs. Okay, so if I am, for example, if I am giving my what to say, submitting my CV in Adobe for some job, my CV will not be seen by a human being. The artificial intelligence itself would be checking out each and everything of my CV more than more than people. They used to check it very properly. For example, a job description needs a job description of particular job is telling that the person should know MS Office. Okay, the person should know Excel. The person should know product management. Okay, so these are the key area, right? These are the key areas which they are looking for, and these are the key skills the person should have. Now, what that AI is going to do? He is only going to capture these words in your CV. Okay, and the moment they realize, okay, this person is doing each and everything that we are asking for, that CV is going to get selected, right? So this is how the AI chooses the resume. इसीलिए बहुत लोगों का वो नहीं होता है, पता है? Whenever you go for corporates, whenever you want to apply, अभी आप लोग Accenture में अप्लाई कर सकते हो, आप अप्लाई कर सकते हो मैकेंजी में, आप कर सकते हो IQVIA में कर सकते हो, आप फार्माएस में कर सकते हो. सो दीज आर द कंपनीज जहाँ पे जब आप रेज्यूमे पुट करोगे वहां पे जॉब डिस्क्रिप्शन पढ़ लेना आप, ठीक है? पहले जॉब डिस्क्रिप्शन पढ़ो एंड देन पुट द कीवर्ड्स that is mentioned in the job description. Then 80% time or 90% time there is a chance that your CV is going to get selected. The thing is that however good candidate you are, your CV is not getting what is that, your CV is not getting selected, you will not be able to perform only, right? You're just rejected. But if in case if you get selected with the resume, uh, later on you can just perform and get the job. But in the first stage itself, if you do not get an opportunity, you will not be able to go. So this is why I say that in the recruitment process of hospital also we can use it to eliminate person where in the initial stage the HR personnel, the normal the assistant HR would be checking the CVs of the people, and he will be finding out what are the key what is that, key skills that person is having. For example, for a nurse recruitment, he has hired he has hired, no, so he has got around 30 CVs, right? In the CV, what is there? Okay, so we want a nurse for HTU. So good clinical experience should be there, 2 to 3 years of experience in the previous hospital. There should be communication skills. There should be what is that? There should be what to say, vital checking ability should be there. The person should have the medication management. The person should can do the medicine management properly. So all these things are mentioned in the job description. Now what the HR is going to do? Look after all the 30 CVs one by one and find out whether one capable candidate is there or not. Now, why we are wasting time over there? Why we are wasting time with the person? Why we are wasting the time of that person? We can use in some good work, right? That person can do something else, isn't it? We can have an AI, and that AI is going to see each and everything. However, we want a candidate. Now, once after selecting, the candidates can come and give interview, right? The efficiency is more, and also you're reducing a person's time, isn't it? So this is what it is. Next is physical network optimization. So what we are talking about this, why we are talking about this over here is, this is also one of the function of operation management. Okay, physical network optimization. Let us see what are the issues we might get in this particular thing. Where should we position appropriate per location pharmacy satellites, warehouse, and supplies to minimize resources and cost? Are you people able to hear my voice? Are you people able to hear my voice? Hello? Hello? Are you people able to hear my voice?
Ma'am, now you are
Ma'am,
audible.
now you are audible.
Why you people are not telling anything if you are not getting my voice?
Ma'am, I was thinking
You are
that
not
my network
audible.
is not bad.
Okay, all right. Let me know whenever you don't get my voice. Otherwise, क्या क्या नहीं सुना अभी? आप लोगों ने क्या नहीं सुना? What I was telling before? What you did not hear? Amira,
You were saying about artificial intelligence, like after CV.
after CV?
About the artificial intelligence, AI.
Yeah, I said about artificial intelligence, but what in that? How artificial intelligence can be used in hospitals? सुनाई नहीं देता आप लोगों को, मतलब तो आप बताओ, ठीक है? एक्सप्लेन फिर से किया जा सकता है, देयर इज नो इशू. I was telling that AI can actually reduce a person's time, and efficiency also will be increased. A particular person from HR would be wasting a lot of hours in selecting a particular candidate by seeing whether the key skills what they are looking for is there or not in their CV, right? So if you have an artificial intelligence already in your in your organization, you will save a lot of time for a particular person, right? So the AI itself would be choosing the CVs, and next interview rounds can happen in the organization. Now it is understandable. You got You got my voice?
Yes, ma'am.
Okay. So we were talking about the physical network optimization, right? So physically, network optimization, how we can do? That means, where should we keep our pharmacy satellites? What is pharmacy satellites? What is pharmacy satellites? Lab satellite, क्या बोलते हैं, डाउनटाउन में है pharmacy satellite is there. Did you see? One big pharmacy in one area and small pharmacies in the departments. Department is there, near to that one small pharmacy is there, right? Isn't it?
Yes, ma'am.
Yes, ma'am.
Yeah. So satellite pharmacies to identify where the pharmacy satellites you have to keep, where the laboratory satellites you have to keep, where the warehouse should be, so that the supplies can come to your organization easily, and we will not be spending a lot of cost in transporting those, right? Next is, do we strategically utilize vendors?
Ma'am,
Yes.
excuse me, ma'am. Ma'am, satellite means, ma'am, main stock. Is it main stock, ma'am?
No. In the sorry, in the downtown hospital, one big pharmacy is there, right? Big pharmacy is there, and in the department, near to the department, there will be one small pharmacy where some of the items would be available, and if there is a need, they would be, like, the requisition will go from the department, and if there is a need, they would be ordering it from the bigger store, okay, the bigger pharmacy department which is there in the organization. So small unit of pharmacies would be available near to the department. So that is called as pharmacy satellite. Otherwise, there are some other system also. I told you already. This shooting system is there, right? In Calcutta, in some of the hospital is there. So from the central pharmacy itself, they would be the requisition will go through the system, through the electronic medical recording. So, for example, HDU has raised an indent. Okay, H2 has raised an indent from 304 bed number. This indent would go to pharmacy, and pharmacy people will get the indent. Now what they are going to do is, they would be using the shooting system, and they would be sending there will be a pipeline. So from the pharmacy itself, they will be sending the medicine to the area, to the department itself. There will be an outlet where the medicines would be sent from the pharmacy. So over here, what is happening? Manpower is getting reduced, isn't it? You are not using manpower over here. देखो एक जो क्या बोलते हैं, एएनएम्स वगैरह होते हैं, या फिर जो स्टूडेंट नर्स है, उनको भेजते हैं वो सैटेलाइट फार्मेसी में सामान लेने के लिए. So for the student nurse also, the time is being wasted, and the person the satellite in satellite pharmacy also, you have to at least keep two to three at least two key people you have to keep, right? Those people could have been used in a better purpose, right? So these kind of small satellite pharmacy, if they, how you have to put, that has to be your consideration. If you do not want to keep this kind of satellite pharmacies, or if you do want to keep lab satellites, then it is your responsibility. You can use some technology which will reduce the manpowers. You understood now, Nahar? It is
Yes, ma'am. Understood,
Yeah,
ma'am.
it is the small unit that will be available in the departments. Okay, for lab also it is to be there, and for pharmacy also it is to be there. Next is, do we strategically utilize vendors and their facilities? Now we can either outsource some of the thing for our facility, जैसे कि pharmacy. ठीक है, pharmacy हमारे hospital में नहीं है. We are just new hospital. new private hospital that we have established, and we do not have the pharmacy in our organization, and we also do not have the budget of establishing a pharmacy, at least at this point of time. Later on future, we might have it, but we do not have a budget for establishing a hospital pharmacy at this point of time. What we are going to have? We are going to have a networking with the vendors, with other vendors, right? So you also have to think strategically that how much far that particular pharmacy should be from our area, so that there is less time in transporting. If there is an emergency, we like should not worry a lot, because the transportation is very easy. And you also should have such kind of bonding. Whenever there is an inventory problem, you can use a just in time process, just in time method, so that whenever there is a need of some particular thing, you would call the vendors and they would be giving that particular thing. Okay. How can we design and position optimal locations for clinic or resources to ensure the lowest total cost? Now you have seen for this, GNRC has their clinics where the OPDs are available opposite to the road, right? Opposite to the road, and the hospital is just opposite to the another like what is that? Hospital is opposite to the another road. So over here, one basic thing is that whoever wants to whoever don't want to go to hospital and don't want to see the people getting sick and emergency exposure, they don't want to get, they will directly go to the OPD. There is the infrastructure is better in that particular clinic, and also it is not so far, so it is easy for the people to access, isn't it? And also, for example, any person wants to get admitted in the hospital, a consultant from the OPD, from opposite side of the road, orders that okay, this patient has to be admitted. Now you go and get admitted in the this particular ward. One person would be accompanying, and then that person would be leaving that patient to the hospital, because it is just nearby, right? So these 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 things, the clinics and all, and this has to be planned in a proper way, so that it is helpful for us to get better revenue. Next is staffing and productivity management. Now over here, performance also comes. Okay, staffing and the productivity management, this is also one of the most important function of the operational manager. Not only the financial or organization and physical layout or planning and all includes, but also HR has their responsibility towards staff, or towards recruitment, or towards training and development. But operation manager also has to keep an eye on the productivity or on the staffing. Now, how much output can we expect from our staff? You have to utilize your staff properly. That HR is not gonna come in. Of course, they would be like they would be there in the process, but the operational manager would be seeing day to day work of a staff. These people would be putting the what is that they would be utilizing the staff basically, right? So in the HDU you have 30 beds, so you can keep around how many one patient no, three patient per one nurse you can give, right? So accordingly you have to decide how many nurses to be recruited, and also you have to keep in mind that shifts will be there for the staffs. So how many nurses will be there for HD, or for a IC, or for a ward? If for example in the ward, this ward is being shut down for at least 1 month or 2 months, what to do with the staffs? Those staffs can be transferred to the different department, so that they can be a help for those people. Okay. Next you have we maximized the use of automation and electronic commerce to increase the productivity? Now every hospital should install EHR system, because that is easily giving us access for patient data, and patient record and share across each and everything, the patient details across the system, right? So you have to have an automation system. You have to have such systems installed in your hospital so that your operation becomes easier, right? If you do not have, that is an issue again. Have we implemented sophisticated analytical model to optimize labor and resource scheduling? Like we have a resource now, we are not using that resource that is going to waste our money. So you have to understand that resource should be utilized all the time. Our OT is there. We have planned 6 to 7 surgeries a day. It is not getting utilized. It is not, like 6 to 7 surgeries are not happening in a day. Now you have to understand what extra to be done in order to utilize those machines, because those machines cannot sit ideally. Okay, so these are the things. Supply chain management and quality improvement today, management I'll finish today only. So just come and join that because meeting is going to get finished.